How long does it take to wean off a ventilator with a tracheostomy in ICU? My name is Patrik Hutzel from intensivecarehotline.com, where we provide strategies and solutions for families in intensive care, and where we instantly improve the lives for families of critically ill patients in intensive care so they can make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always, even if you're not a doctor or a nurse in intensive care, so that you can instantly improve the lives for you and for your family member in intensive care. So if your loved one is in intensive care with a tracheostomy and still on a ventilator, how long will it take to wean them off the ventilator? How long will they need the tracheostomy, and what affects the speed of recovery? These are some of the most common and crucial questions families ask when faced with prolonged ICU stays. Let's break this down. First, understand the process. A tracheostomy is a surgical opening in the neck into the windpipe, also known as the trachea, that allows a breathing tube to be inserted directly into the airway. In ICU, a tracheostomy is usually performed when a breathing tube through the mouth, also known as an endotracheal tube, has been in place for more than 7 to 10 days. Other literature might suggest 10 to 14 days. Next, doctors expect the patient will need ventilator support for longer. Next, a safer, more comfortable airway is needed for prolonged care. A tracheostomy doesn't mean the patient will be on the ventilator forever. In fact, it can make weaning off the ventilator easier in many cases. Let's look at weaning and what it really means. Weaning is the gradual process of reducing ventilator support so the patient's lungs and breathing muscles can take over. This usually happens in stages. Number 1, reducing sedation so the patient is awake enough to breathe on their own. Number 2, spontaneous breathing trials, also known as SBTs, short trials where the ventilator provides minimal support. Number 3, increasing spontaneous breathing trials time daily, as long as oxygen levels, breathing rate, heart rate, arterial blood gases, etc. remain stable. Number 4, trach collar or TPs trials, breathing without ventilator support while still having the tracheostomy in place. Number 5, cuff deflation and speaking valve capping trials, testing whether the patient can breathe through the nose and mouth with the trach tube closed. And number 6, decannulation, removal of the tracheostomy once the patient can protect their airway, cough effectively, and manage secretions. So how long can all of this take? Well, there's no one-size-fits-all answer. In a straightforward case, or in straightforward cases, such as after pneumonia that is resolving, weaning can take a few days to a couple of weeks. In complex cases, such as after ARDS, sepsis, multiple surgeries, severe weakness, multi-organ failure, weaning can take weeks to months. Some patients can make fast progress while others slow down if complications such as infections, secretions, issues, or fatigue arises. Next, let's look at factors that influence weaning time. Reason for ventilation, routine surgery versus severe illness. Lung condition, ongoing pneumonia, fluid, or scarring of the lungs is slowing the process. Next, strength and mobility, weak breathing muscles and general deconditioning causing delays. And that's why it's so important that your loved one gets mobilized and gets physical therapy and physiotherapy as early as possible. Next, sedation and alertness. Patients must be awake and responsive. Next, secretion management. Weak cough or thick mucus can delay trach removal. Next, infections. Any setback can delay weaning by days or weeks. What questions to ask the ICU team? As an advocate for your loved one, here are some critical questions you can ask the ICU team daily. What is today's weaning plan? How long did they tolerate the last spontaneous breathing trial? Are we doing trach collar or TPs trials yet? What's the plan for cuff deflation and capping trials? What's being done for physiotherapy, respiratory therapy, mobilization, and nutrition to build strength? Also, a important question to ask is ICU the safest place for weaning? For patients still ventilator dependent, ICU may or may not be the safest environment with highly skilled staff and immediate intervention if breathing fails. Another valid option here is intensive care at home. So go and check out intensivecareathome.com, our other website, where we provide intensive care services in the home for long-term ventilation, tracheostomy, including weaning. For our audience in the US, transferring too early to a facility with less monitoring, like an LTAC or a skilled nursing facility, can be deadly and very risky and life-threatening if the patient is unstable. But the best option for long-term weaning, if not done in an ICU, and also safe option, is intensive care at home. Once again, go and check out intensivecareathome.com. What are the key takeaways? Weaning from the ventilator with a tracheostomy is a gradual and highly individual process. It can take days for some and months for others. The key is to measure progress by tolerance of breathing trials, stability and ability to protect the airway, not by the calendar. With the right ICU support or intensive care at home, once again, you can check out intensivecareathome.com, clear daily goals and strong family advocacy, your loved one has the best chance for a safe and successful weaning journey. So if you have a loved one in intensive care right now with a tracheostomy and ventilator dependence, if you are struggling to get clear answers from the ICU team, if you want one-on-one consulting and advocacy, visit us at intensivecareathome.com and book a call now. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecareathome.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecareathome.com, and you can verify it on our intensivecareathome.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecareathome.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecareathome.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecareathome.com with your questions. And if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecareathome.com email newsletter at intensivecareathome.com. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.